Welcome to Flourish Well, the wellness podcast where we explore what it truly means to live healthier, move better, and feel more grounded in everyday life. I'm your host, Naomi Dillon, and each month we shine a spotlight on a different dimension of well-being, from physical health to emotional resilience, stress, relationships, and everything in between. This month we are focusing on a topic that oftentimes comes up in my patient sessions: trauma in the body. We explore how chronic physical conditions may have their root in someone's previous traumatic experiences and how this is best handled with a team of trauma-informed providers, including therapists and physical therapists. Today we talk with Grace, owner of Campsen Wellness, and a therapist who specializes in trauma and EMDR. She's a therapist who balances space for self-reflection while challenging her clients to uncover unseen parts of themselves in a safe, judgment-free space. Seeing the intersection between body and mind is not a new realization for Grace. Growing up with a physician and a physical therapist as parents allowed for an early understanding that mental health plays a role in physical health and vice versa. Outside her office, she loves spending time with her beloved dog Lottie, hiking, reading, and baking. You can learn more about her practice from her website, campsenwellness.com, or follow along on her Instagram at therapywgrace. Let's dive into today's conversation. Hi,
Cool.
Grace. How are you?
I'm good. How are you?
I'm doing well. How's your day been?
It's been good. I just had a couple clients. Took
Nice.
the dog for a walk. It's freezing again. So,
Chilly winter. Gotta love it. Well,
yeah.
thank you so much for coming on the podcast today. I'm really excited to chat with you about trauma and how that interacts with the body, as I have a lot of patients who I end up referring to therapy because there's something else sitting there that I am not qualified to treat. And so I find that working in a team with therapists is a lot better for my patients. We get better outcomes in the long run when we combine forces. So excited to have you on.
Yes. Thank you for having me.
Of
Yeah. I
course.
love referring to PTs. I think it can be so important because of that like mind body connection that's not always acknowledged in both fields on the other side of things.
So true. Well, and one of the things that really stood out to me about you is I am usually the one reaching out to therapy, and you reached out to me, and I was like, wait, this is so
Yeah.
cool. And then finding out that your dad's a PT, and so like you understand like both
Yeah.
sides of the coin. So that's really
Yeah.
really cool.
Yeah. I know. It's always like growing up with a physical therapist father was like so annoying because it was always like, you need to go on a hike, you need to be mentally strong, you need to do this, you need to do that, you need to be in 4 sports. And that was like not who I was as a kid.
Sure.
And he actually was very like sports focused. He was like the athletic trainer at our local high school. And so now, as an adult, since I've done a lot of mental health and we talk all the time, he does so much more chronic pain and pain science
Mm,
and is kind of like shifted. And it's so interesting,
is
like
interesting.
how he's changed as a
Yeah,
PT because he's learned from me as a mental health therapist of
I
like,
love that.
you can't just dismiss people because
Also,
you
yeah,
can't find what their pain point is because
right.
it's neurological, you
Right,
know?
right.
So,
Yeah, I love that. That's awesome. Well, excited to dive in with you, and we'll just jump right into the first question here.
yeah.
So as I mentioned, I often see patients with chronic conditions, and when I hear they're not in therapy, I generally refer them to a therapist. How do you start working with someone who has had a traumatic past, even from like a medical standpoint? Because I think a lot of people tend to write that off as, oh, that's not trauma, but it is. Who has never tried therapy before. So how do you start with somebody
Yeah.
who's new to the
I
therapy
think
world?
this is kind of going to lead into the second question too, but this is when having a trauma informed therapist is so important. And it really just boils down to what, or are we okay as providers taking time to earn trust, to build rapport slowly, and to be patient with clients because so often they're not believed, they're disregarded. And we shouldn't automatically assume that we're going to have that rapport just because we're the expert in the field or in the profession. And so, really, just going low and slow with people tends to be the most important when somebody has a trauma history. For you as a PT, it might mean, like asking somebody if you can touch them before you start an exam, or during maybe like an internal pelvic floor exam, talking them through what you're doing so they know what to expect as it's happening. For me, a lot of times I feel like it's it's asking them about their story and validating that what they went through was really hard without them actually telling you the entire story. We don't always get the honor of knowing their whole story right when they walk in the door. And I don't need to know their entire life story to know that the pain that they have experienced and the trauma is valid. So I think that's kind of the
Yeah.
big part of when somebody comes in and has a trauma and is kind of skeptical about whether therapy is going to be helpful.
Yeah. That's I find that giving space is so huge, even like in my setting, right? Like just giving people the chance to talk to you and letting them open up is a really big deal. And I just lost this thought. What was it? Anyway, so like I have a follow-up question to that, which is I find that some people who have traumatic pasts have like this like no, I need to check the next box on the list. And so if they're not like achieving something in session 1, they're like I'm done. And they require a little bit more encouragement. How do you balance that like slow build, like good rapport building, but also building trust with like, okay, but I'm also here to get things done.
Yeah. I mean, so that's kind of built into my informed consent because
Mm-hmm.
I've noticed that also just
Yeah.
with the populations that I work with. They
Sure.
come in for 3 sessions and they're like, "Well, why has nothing changed? I'm mad that I'm talking about my marriage when I wanted to talk about my trauma." And really it's
Mm-hmm.
about, okay, how can we get your environment to be conducive to processing like the deep wounds or the shame and guilt that you're experiencing. And a lot of the times when people come in the door, they're not ready to like dig into the deep stuff. They need to have their environment conducive and safe and well balanced before they can kind of dive deep. And so that's part
Mm.
of my informed consent is that, you know, usually we need to be working together for 3 to 6 months before we see like a huge amount of change. So they're told that right off of the bat. And we can go back to that. And I think it's also to add on to what you said about um, people want results immediately. I think sometimes people are like, well, it was just a small thing. It wasn't a big deal. And I think
Mm.
another part of being trauma informed is recognizing like there's no threshold for trauma. It's more how did the fear mess with your nervous system? And it doesn't have to be this big, horrible thing that you went through or this super traumatic child abuse. It could be small things by being invalidated by doctors and having chronic pain. It
Yeah.
doesn't have to be, being in war or being sexually abused or anything like that.
Right. I think that's a really good reminder, especially for PTs in the field, right? Like I'm very, before I enter any like no square type area, I'm
Yeah.
warning you, right? Like we're talking about what I'm doing as I'm doing it. I remember having one of my professors in school who taught soft tissue mobilization. He was really big on um, when you switch sides on the table, you don't take your hands off the patient, which is fascinating, right? Like you've already gotten this consent, but you need to switch sides. And so you can't, like, people don't want to be surprised by a new hand appearing, right? And that's
Yeah.
like when I do my internal exams, like it's not all of a sudden fingers at vaginal opening, right? Here's my hand on your knee, here's my hand on your inner thigh, like moving down towards your sit bone, right?
Yeah.
Like narrating, which we aren't taught in school, right? Which boggles the mind. Um, and it's interesting to hear you talk about how like, it's the fear response that's critical, right? Into forming something that is traumatic. Because that can come out when somebody's on my table without me knowing it, you know?
Yeah. Totally. Yeah. I
Yeah.
mean, trauma is a demonstration of how powerful fear is to the human brain and body when
Mm,
it really like comes down to it. Like it's
yeah.
just so fear does so much stuff to the human body and the human brain that we don't even realize because it's hidden away to protect us so we can move through the world and keep existing in our normal lives.
Yeah. Yeah. Intense,
Yeah.
wild.
Yeah.
So, second question here. How is working with a trauma informed therapist different than working with like just your average therapist who
Yeah.
doesn't necessarily get that certification?
Yeah. So a non-trauma informed therapist isn't necessarily bad. I mean, would say most people are not most, I would say a good chunk of people in our field have not done trauma-informed training or have done kind of subpar training because it's
Mm.
like a very trendy thing right now. Everybody's
Mhm.
talking about their trauma, everybody's destigmatizing mental health. And so there's all of these like little trainings that don't actually always like get to the point.
Mm.
But I think one good example would be like cognitive behavioral therapy. So somebody who's traditionally trained in cognitive behavioral therapy, which most people are, that's kind of like the most empirically supported therapy. Most grad schools, that's what they're teaching you.
Mhm.
If they don't also incorporate a trauma informed lens, they're just going to be teaching you. Well, let me like go through an example.
Sure.
So somebody who's trained traditionally in CBT without a trauma informed lens, they're gonna help you. You're gonna come in the door. You're gonna say something like, I go to the doctor for this chronic pain, and I have pain in my knee, and it won't ever go away, and it comes up when I'm stressed about X, Y, and Z things. And I've explained that to the doctor. They've run some labs, but I must never explain it right, and no one ever understands what I'm saying. CBT principles would tell me as a therapist to teach you about cognitive distortion. And cognitive distortions are really just defined as like thought patterns that are distorted or that are maladaptive. That might be like overgeneralizations or catastrophizing, the times when we like jump to conclusions or we make assumptions about what other people think about things. And so then we would work to like identify, okay, it's not that nobody ever understands you. It's not that you never explain things right. So you would work to identify kind of those distortions and then notice when they're happening more readily and then kind of shift them and change them of like, okay, maybe this doctor doesn't get it, but the next one will.
Mhm.
Or maybe my doctor doesn't understand me, but my partner does. And so kind of trying to like minimize the distress that comes from this like no one and never, this all or nothing thinking.
Mhm.
The problem with that kind of therapy is that there it is a real fear and it is a real legitimate concern because people aren't believed in the medical system for their chronic pain. People aren't believed for different abuses they face sometimes. And so if I'm sitting here and telling a client, it's not true that it's never happens and that no one gets you, that's kind of invalidating because they've probably seen 10 doctors who told them, well, I can't find anything on your scans or in your labs, so it's not real.
Right. Right. Right.
So it's about, instead of invalidating, being like, okay, I get that, and how do we work through this distress and find somebody who will listen to you rather than being like, no, you're probably fine, like
Right.
just let's work through it.
Right. Yeah, and that's interesting. I think there's a bunch of other examples of that too, right? Like, oh, you have a weird interaction with your mother-in-law and you complain to your partner, or you complain to your friend, and that friend responds and says, "Well, I just don't think that's true all the
Yeah.
time." There's no way that she's always like that. Like there have to be some good moments. And that's the kind of friend who you're like, "I don't know if I really want to hang out with you again," or
Right.
like that's
Exactly.
something that causes some major distress within a marriage, right? Is
Yeah.
the invalidation of experience. Um so that's interesting. It still incorporates maybe some CBT
Yeah.
elements, but there's just more validation behind that.
Yeah. Yeah. And it's more um behaviorally focused in that you're going to find things that work for you rather than trying to work in a system that's not working for you. So we're not going to stay going to the same doctor that's being invalidating. We're going to find another doctor that works,
Right.
you know.
Yeah, it's more empowering in a sense.
Yeah, cuz my job isn't to pile on, like it's to help you find peace and acceptance of your body if you've been through a lot of medical trauma.
Yeah, and I think that's a big element that a lot of people with chronic issues deal with is they
Yeah.
feel at war with themselves, and having a medical team that doesn't help you work through that is not really helpful.
Right,
Right? Because it can just
exactly.
make that relationship worse.
Yeah.
And so how is your nervous system supposed to be at rest? Like you're talking about setting the right environment, right? If you don't even have the right environment within your own body, that's going to be really hard to
Yeah.
feel safe.
Yeah, definitely.
Yeah.
And that can also be when somatic therapies or EMDR or brain spotting can be really helpful for those people that are like, I know what the problem is, but I can't change how I feel, and it doesn't make the chronic pain go away, and I'm still stuck in the situation that I'm in. They can really help kind of get to the feelings and the deeper processing that sometimes talk therapy, I find, misses a little bit or goes a lot slower with.
Yeah.
Because you can still have a little bit of like a, I know some people come in with a little bit of a guard up because they've been invalidated so often, and they can still have that guard up, and I can slowly work to build rapport and earn that trust without them having to fully put that guard down.
Mm-hmm.
You know, because there's not a lot of talking with EMDR, somatic
Sure.
therapies, or brain spotting.
Yeah, I've heard of EMDR. I've heard a little bit about somatic therapies, but I don't know very much about brain spotting at all.
Yeah.
Can you talk about that a little bit more?
Yeah, so I'm not a brain spotter.
Sure, sure, sure.
I could connect you with somebody you could have on the podcast. We
Sure,
might do
yeah.
it. Brain spotting is it's less empirically supported version. Well, it's not a version. It's a similar to EMDR that it feels a little bit more like hippie, a little more
Okay,
spiritual.
sure.
EMDR is very protocolized. You follow steps as you go through. It's a lot more formal, I would say, and stiff than like traditional talk therapy. Brain spotting, I would say, kind of incorporates both a little bit more, but it's also super new. And the brain spotting people, if you will, have really kind of like poo-pooed research a little bit. And so it's very under-researched right now.
Okay, interesting.
But people who are trained in brain spotting do a lot more training on themselves. In EMDR, you get some personal EMDR for your own stuff to just like experience what it's like, but not to the degree that brain spotting does. So I think that's
Interesting.
the interesting fact about it. It's a lot more immersive, I guess, the training.
Interesting.
Yeah.
Yeah, it's like we talked about earlier about, it's an honor to hear everyone's full story, but you don't always get the full story, right? Like, I think that oftentimes that's what holds people back from seeking therapy is they don't want to talk about things again. But
Yeah.
EMDR and these other therapies, right? There's not a lot of talking about the trauma involved, right? Like you don't have to share that.
Like when I do EMDR with people, I need to know that the train is moving, that you're not stuck in a memory, and that you're okay and you're like within your window of tolerance and you're not super dysregulated, that you're like going to have a panic attack or dissociate. So you can process through your internal world a lot more safely sometimes than you can if it's talking.
Yeah, interesting. Yeah, and that's what my thought was earlier is I remember like before when I started doing pelvic floor therapy, there was a lot of like, I need to know the details. Why do I need to know the details? You know what I mean? Like, I need to know the details. And then I actually listened to The Body Keeps the Score, which I know is like, there's some debate about how helpful that book is. But that was really the moment that I was like, I really don't need to know. I just need to know what the pain is and I can figure out the body part. And then I need a really good therapist to be on board who can really help this person, work through whatever's going on if they don't already have that. But I think it's helpful for people to know that, talk therapy and these other forms of therapy can be very helpful to reprocess trauma. Yeah.
Yeah, definitely. Because it's the same as what you're saying. Like, I don't need to know what happened to be able to help you. And sometimes it feels too scary to talk about what happened right away.
Yeah, 100%.
So, yeah.
So that kind of leads us into my next question. I don't know if you see these videos on TikTok, but I feel like I see them all the time. And that may be because I'm a pelvic floor PT, but everybody loves to talk about how if I do pigeon pose correctly, I'm going to release the trauma that's stored in my hips. This points to me to a larger truth, that trauma itself is in the body, right? It's hidden, it manifests in the body oftentimes. What are some common ways you see this in your clients? How do they kind of manifest with physical symptoms?
Yeah, I love this question because I think it goes back to what we were talking about at the beginning, that like PTs oftentimes aren't trained to account the like mind-body connection on the mind side, and therapists oftentimes, I feel like, aren't trained to notice the body side of the mind
Mm.
body connection.
Mm-hmm.
And like you said, I really like the body keeps the score, even though there's like some debate. I think it's a good basics to know, to kind of explore. Another book I really like is What My Bones Know.
Mm.
That's a super good one. It's a memoir, but it talks about how she holds this trauma in her body from her childhood, and this process of her like recognizing it and making lasting change that she didn't realize she was like holding on to for so long. But I think really commonly some people will come in with stomach aches, headaches. I had somebody a couple weeks ago say, "Yeah, I used to faint all the time when I was stressed." It was like,
Okay.
so you had like a full vasovagal response. And you didn't realize that that was stress related. You just thought it happened sometimes.
Yeah. Oh my
Um,
gosh.
yeah. Other people will have tension, like a lot of times their neck or shoulders, like you said,
Mm-hmm.
in their hips. When it shows up as physical tension, I think a lot of times like low impact movement can be really restorative. Yoga, walking, something that's like kind of low and slow is going to make you feel rested afterwards rather than like exhausted. Some of my clients that are more active, like rigorous movement is restorative for them.
Mm-hmm.
So I definitely encourage that too. It just might not always help with like the physical tension part of things. Um, when symptoms show up more as like nausea or headaches or stomach aches, I think one like really quick trick or easy trick is like naming what's going on in your body. And it can be to yourself and it might feel kind of silly, but saying out loud, like, oh, I have a stomach ache because I'm getting labs done tomorrow and I'm stressed about that, or something like that. And so kind of naming it out loud and saying it helps the brain make the connection and be like, oh,
Mm-hmm.
okay, I know what's happening. I don't need to like shoot off all this cortisol.
Yeah.
I don't
Right.
need to be in fight or flight mode to the point that I can't sleep tonight. Like I can just dial it back a little bit.
Yeah, a personal example of this is so I had a stress fracture
Yeah.
that I got back in October,
Yeah.
and I have been rehabbing and everything for the last 3 months, and like it doesn't bother me anymore, right?
Mm-hmm.
Last night, Tuesday, I got cleared to begin running again, and so I'm beginning my return to run protocol. And I for like 30 minutes before my return to run, first run, whatever, which I'm literally jogging for 30 seconds and walking for 4.5 minutes after that. Like, it's not like this is like the
Yeah.
babiest of baby runs. Okay.
Right. Couch to 5K. Yeah.
Yes, exactly. My fibula was like hurting. Like, it was like
Yeah.
throbbing and it felt really tight. And I was like, what is happening? Like, this is ridiculous. Like, I'm walking around my house, like it hasn't bothered me. I'm like poking at it. I'm like, oh, it's not point tender, so that's a good sign. Like, and then I go out on my run, I feel completely fine. And so I'm like, you know what it is? It's the fact that I was worried about how I
Yeah.
was going to respond to this run. Like, this is a
Yeah.
pressurized moment that I have for some reason put pressure on myself, you know, and who knows like what in the past has
Yeah.
contributed to that. I'm sure there are things. But like, if you don't have the training that I have, you look at that and you go, oh no, something bad has happened, right? Like, I've re-injured this, I've done, and then you can just end up spiraling from that point, right? But that wasn't an actual like physical issue. That was my brain trying to be proactive and protecting me
Yeah. Yeah. Which
from
is so
whatever.
cool.
Right.
I feel
Right.
like obviously it screws people up. So like it's not always cool, but it's so cool that our brain has that protective mechanism built in.
Yes.
And the more we can be like, oh, I appreciate my body for doing that.
Mm-hmm.
And also I can tell it doesn't have to be worried anymore.
Right.
It's so cool
Right.
what our
Well, and
brains can
that's
do.
when I have a similar response when people do too much, in terms of like if I ask them to do something on the table and they like go at it tenfold of what I asked them to do, right? I'm like, that was a really good job. That was you trying to get a gold star in PT. We don't need to
Mm-hmm.
get a gold star in PT.
Right.
You're doing great already. Like,
Yeah.
tone it down a little bit, right?
Yeah.
And I feel like there's a similar response with like the physical portion of symptoms, right? Like, if you
Mm-hmm.
don't have somebody who can help you kind of figure out like what each of these responses are and figure out what your typical patterns are, then you're going to have a harder time making a full recovery,
Right.
and full recovery is, I guess that could be argued, but to be able to manage what's going on.
Yeah. Yeah. No, it's so interesting. And I think another, maybe this isn't necessarily like a physical example, but a lot of times people will be stressed, I'm trying to think of a good example. If somebody's going home and they're away at college and they have parents who are divorcing or something like that, and they're really stressed the week before they go home, and like they're getting in fights with their partner, or they're tired all the time, like recognizing, oh, my brain is trying to like make me dial back because I'm not dialing back because I'm trying to prepare for this thing that's upcoming. And so sometimes we don't realize that our brain does that further in advance than we realize all the time.
Mm-hmm.
And so kind of noticing those things, even if they're not necessarily physical symptoms, there's still kind of an interpersonal piece that can come up. And I guess the sleep would be more physical thing too. But
Yeah.
yeah.
That sounds similar to, like I hear stories of people who've had traumas at specific ages in their life,
Mm-hmm.
or like where big life events happen when you're a kid. Like I feel like I heard a story recently of someone who had something major happen to them at like 6 or 7, and then when their kid is like about to reach that age, like the adult starts to have like issues,
Yeah.
and is picking fights more often and things like that, and like come to find out, okay, it's actually probably that your child is entering that stage of your life where
Yeah.
you lost that piece of safety,
Mm-hmm.
from whatever happened, which is so fascinating to
Yeah.
me.
Yeah. Yeah. When it goes back to the how powerful trauma is just how powerful fear is in the body. It's
Mm-hmm.
so interesting. And that epigenetic piece, there's so much more research coming out about that.
Yeah, talk about that a little bit.
So if you don't know, I'm sure you know, but for the listeners,
Yeah.
so epigenetics is just the idea that there can be intergenerational trauma passed down through generations. So if my mom, for example, was in a really unsafe environment and didn't feel like she had her basic needs met, or was being abused or whatever, I might have similar trauma responses, or I might be more easily stressed out, or on the contrast, less easily stressed out and have not a good meter for that, because because she didn't have a meter and her meter was kind of burnt out. Um, and so it's there's a lot more research coming out about it, and I think it's super interesting,
Yeah.
that like generational trauma piece of things. Um,
That's a really interesting way of explaining that, because I've always like I feel like that gets used as a cop out a lot of times. Oh, it's just generational trauma. And I think that kind of fits in with this question because it feels like one of those like online hot topics
totally.
at the moment.
Yeah.
But that's a really good perspective to have, because I feel like that puts your own response into better context
Yeah.
versus like generational trauma being this like amorphous thing that nobody knows what it
Yeah.
is. You know what I mean? Like,
Yeah.
I'm not blaming you directly, mom. Like
Right.
I'm blaming the fact that I just don't know how to regulate
Yeah.
whatever.
Totally. And here's a personal example that I feel like I can share. So my mom, when I was born, when she was pregnant with me, she was in medical school in her residency. And for people who don't know, residency is incredibly stressful. Back in the 90s when she was doing it, there was far less regulations.
Yeah.
They were working 80 hours a week, and should not have been. They were getting humiliated by attendings and more senior physicians on a regular
Mm-hmm.
basis. So if you think about a pregnant person being in that situation and being exposed to that much stress that often,
Yeah.
she had to achieve, and she had to feel like she was achieving and be perfect all the time. And so I grew up, and part of this could be being an oldest daughter, but I've often thought about in the context of, why do I feel like I need to be achieving all the time and
Mm-hmm.
have this like fear if I'm doing something wrong? And my parents were not punitive parents at all. They were wonderful. And so why do I have this like
Mm-hmm.
response
Yeah.
from just like doing a simple thing wrong or forgetting something?
Yeah.
And sometimes I've thought, is that because when I was growing in her belly, she had to be on guard. And so that was like our evolutionary process, preparing the next generation
Yeah.
for concerns that they might need to be prepared for,
Right. Right. Yeah. Fascinating. Well, and also
Yeah,
all the cortisol that you may have been
totally.
exposed to, like your system's just really good at cortisol.
Yeah, yeah,
Yeah.
totally.
Yeah. That's
Yeah. So
intense.
it's so interesting, that generational thing, and I wish it was less. I think it's so cool when people are talking about it, but right now with social media and with where things are in the world, things get politicized so easily, and there's such an important piece of generational trauma that's maybe not getting explained correctly or not getting acknowledged the way that it should.
Yeah. Yeah. Well, I think people speaking out of their scope too. I think that's
Yeah,
another issue
totally.
is that's for you, my therapist, to tell me, you know what I mean? Not and
Yeah,
or my doctor to tell me. It's not necessarily somebody who is a wellness coach or anything like that. Like
right.
you could hint at it and say, "Hey, I think you need to go to therapy," but
Yeah,
like
yeah,
stay in your lane,
yeah,
like do your thing.
yeah,
Yeah.
definitely.
So with stress and anxiety, what are three things that you typically recommend to people to like help them kind of process or I heard somebody use the word metabolize once, which I think is
Yeah,
really fascinating,
yeah,
to metabolize those feelings and kind of get
yeah.
them through the body.
Yeah, I mean, I would say metabolize is good, regulate any of them.
Mm-hmm.
Um, this is what I would refer to more as like grounding when
Mm-hmm.
you're like acutely stressed out.
Mm-hmm.
And my three big things that I recommend are diaphragmatic breathing, progressive muscle relaxation, and sensory grounding. So, diaphragmatic breathing, some people love it, some people hate it. I have a lot of teenagers that are like, don't tell me to breathe. But
I'm
it's,
over it.
yeah, breathing is stupid.
Yeah.
Yeah. So focusing on the breath coming in and then holding and then focusing on the breath leaving the body and feeling your belly fill, feeling the air in your belly when you breathe out, feeling your belly deflate. Really focusing on that kind of switches your brain's gears from, okay, I'm about to have a panic attack. I'm freaking out right now. I'm crashing out to, okay, I need to focus on my breath. And that helps kind of turn on the pathway from your amygdala back to your frontal lobe. Because when you're in fight or flight mode, that pathway is not communicating. It's
Mm-hmm.
just in your limbic system. And so if you can distract your brain almost a little bit to turn it back on, then it's like, oh, okay, I don't need to have a panic attack right now. I
Yeah.
can handle it. It'll be okay.
Yeah. So it gets you out of that fear response brain into that, like,
Yeah,
I'm able to rationalize.
right.
Right.
Exactly.
Yeah.
Yeah. Progressive muscle relaxation is the second one. It can feel a little silly, but it's also kind of a subtle thing that you can do like in a room full of people. So
Can
I
you
always
guide
tell
us through?
people, what?
Can you guide us through one?
Yeah. So you can do, like if you start at your toes, notice the sensation of your toes, curl them, tighten them, tense them, hold it for a little bit, release. Now feel your ankles, roll them, tense them a little bit in any way that feels right. Hold and release. And then you can kind of keep moving up the body. And then if you still don't feel fully calm, so you'd move up the body all the way to your head, move back down if you don't feel calm still. And you can keep doing that. And it's kind of pretty subtle. Like people aren't going to notice if you're at work doing that or in a classroom doing that.
Yeah.
Um, so that's a good one.
Yeah.
But the third one is sensory grounding. So two examples of that would be like finding the rainbow in the room. So going through the room, finding something that's red, orange, yellow, green, blue,
Mm-hmm.
purple. Or like I'm sure everybody's heard of the 5 4 3 2 1 thing. 5 things you can see, 4 things you can feel, and on. And that is the same idea of it helps you anchor in the present moment and kind of distracts your brain momentarily so that pathway can turn back on again.
Yeah, I love that. I hadn't heard the rainbow one. I love that.
Yeah.
Because that's another fun one from the 5 4 3 2 1. If
Yeah.
people want, my ADHD brain is like, oh, give me
Yeah.
something new and
Right.
exciting.
Yeah.
Yeah, and there's a lot of overlap too with, I talk a lot about diaphragmatic breathing. I spent like, a half an hour this morning with one of my patients talking about
Right.
it because it does so much for so many other things.
Yeah.
But it's really helpful to reduce tension and, like you said, get out of fight or flight and
Yeah.
also all the pelvic floor benefits. So
Yeah.
there's a lot of help there.
Yeah. It's supposed to increase blood flow too. There's a lot of benefits to it.
Yeah, it's
Yeah.
huge. Love that. And then what strategies do you use to help people work through physical symptoms they may experience when they're currently being triggered or something,
Yeah.
came up in their day?
Yeah. So to me, this question is more about like the more long-term processing. So even if they're being triggered acutely, they do kind of one of the three things that we just talked about. They still should go to therapy and or be actively reflecting on these things, introspecting on these things. And I think a big part of that growth or progress is self-compassion and finding your village or building your village. Um, I think we're in a self-care craze world right now of setting boundaries
Mm-hmm.
and isolating and being individualist. And
Mm-hmm.
there's space for that and there's a need for that. And also having a village and nurturing that village is equally as important. And so many people walk through my door and feel so alone. And if they felt like they could rely on people and that people would be there for them, I think a lot less people would be walking through my door.
Mm-hmm.
Um, so I think those are the big things: self compassion with the nuance of like, we can't self care away our problems, and leaning on people um, that you know that you can care or that care about you and that you care about. And if you
Yeah.
don't have those people, really making a concerted effort to like find those people or repair those relationships with people.
Yeah, that's huge. I'm thinking of have you seen the pain web?
No.
There's a paper that was published, I think it was 2017, and this is like it's kind of an opinion piece, but it's also based on a consensus statement that the Low Back Society made a couple of years before.
Yeah.
Um, Talking about how there's 200 different factors that affect low back pain, right? And most people only think of their spine and the muscles around it and the nerves and the disc and da da da, whatever.
Yeah.
One of the main things that they talk about in there is social support and how huge that is to help people who are living with pain. Like, do you feel like you have someone who you can trust completely? Do you feel that you're supported by the people around you and that they love you? Do you feel alone? Like all of these big questions that play a huge role in how we view ourselves
Yeah.
have a huge impact on pain. And like when you think about it for a second, it makes sense, right? But
Right.
like when you're in the middle of that like low back pain flare up, you're kind of panicking because you're like, what did I do wrong? Well, maybe you got into a fight with your partner, maybe you just went through a breakup, maybe your best friend isn't talking to you right now, and then something else happened and your nervous system wasn't prepared for whatever that physical thing was, and now you have this, you know, reflare of your back pain. So I will put that up in the video when I post this to YouTube, but and I'll send it to you as well because it's really
Yeah.
fascinating.
Yeah. It's so cool. It's
Yeah.
just, it's so interesting how our brains and our bodies are connected, and it's so under researched right now.
Yeah, 100%. So what does good self-care look like? Like what does good boundary making look like for you? Like how do you usually help people work through that?
Yeah. Um, it's, I mean, it's different for everybody. Not that that's a
Sure.
good answer. I'm like, it depends.
No, that is a good answer.
I think it's not self care is not the I'm gonna get a face mask and go get a massage and put my phone on do not disturb. Sure, if you need that,
Mhm.
that's great. You can do that, but also being very intentional about what things fill up my cup, what things drain my cup, and what's worth it to drain my cup a little bit,
Mm,
and what's worth it to not drain my cup, and being very intentional about that. Because every time somebody asks you for a ride to the airport, and you're like, no, that's like a 40-minute drive. I don't really want
mhm.
to do that.
Yeah.
And it might drain your cup a little bit, but also next time you need a ride to the airport, that person will be there for you.
Right, right.
You know. And so I think there's an intentionality behind self care, and it's different for every person. For some people, exercising is really restorative. For some people, being alone and reading a book is really restorative. For some people, just going on a walk and being in nature is restorative. Spending time with their pets, spending time with their friends, watching movies, like knowing what makes you feel better and kind of doing more of that when life is feeling hard so that you're more prepared and you have that cup filling when you know it's going to be drained later on that day or later on that week or something like that.
Yeah. I love that perspective because I feel like there is a shift. I don't know if you've noticed this also, but there's kind of a shift going on social media where I feel like a lot of millennials are like, no, you Gen Z, like you don't understand, you don't want to be a part of a village, da 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 da. And so like you need to be uncomfortable to be a villager, but at the same time, like how do you balance? Like there's got to be some like middle
Yeah,
ground, right? Like you can't be a
totally.
people pleaser, but you also can't cut everyone off,
Yeah,
right? So
yeah,
like I like how you kind of frame that, right? Of like, okay, take some time, help yourself to restore before or after, you do the thing that kind of drains you a little bit. But it's
hmm
good to have something that, drains you a little bit too, because that's your village, as
yeah,
long as it's healthy.
yeah, right,
That caveat.
exactly. Yeah,
Yeah. Yeah.
yeah. Because I think it's also generational. I just saw this on a listserv the other day. It's there is a generational pattern that we talk about in the psych field, and I feel like everybody should know about it. Every generation feels like the next generation isn't going to be okay or isn't going to
Mm-hmm.
figure it out.
Yeah.
And we're all going to figure it out. We're all going to
Mm-hmm.
exist on this earth
Mm-hmm.
and keep moving. Like
Right.
the world's never going to stop moving. And so the more that we can just maybe not stay in our own lane, but be curious and wonder and encourage rather than being like, you don't get it. You need to do better at this or you need to do better
Mm-hmm.
at that.
Mm-hmm.
Because Gen Z and Gen Alpha and younger are growing up in a world where information is readily accessible. You can't always rely on it,
Mm-hmm.
you
Mm-hmm.
know, and the world seems kind of bleak right now. And so, of course, they're going to be stressed out and they're going to need more self care and they're not going to trust other people because there's a lot of untrustworthiness going on in the world right now. And so, how
Mm-hmm.
can you find those little people, that little circle or that little bubble in your corner of the world that you can trust and you can feel safe?
100%. It's being discerning.
Yeah,
Right? Like,
totally.
I think of like, there have been periods in my life where I needed to be what some people would call antisocial. And that
Yeah,
was like good for my mental health. And then now I'm in a period where I'm like, okay, I'm pretty comfortable like seeing people,
yeah,
as long as I'm not overbooking myself,
right.
right? But like, even with how crazy the world is right now, like there are some topics that I know that I can talk about with some people, and there are some topics that I know that I cannot speak about with some
Right,
people. And
exactly.
so, you know, figuring out ways to kind of move that conversation if somebody brings it up who I don't want to speak to about that topic, right? Like, because I still need to maintain a relationship with them for whatever reason, right? Like, there's ways around it, and we all kind of have to figure that out in our own time.
Yeah. And knowing that everybody's baseline is different too. Like
Mm-hmm.
my sister is way more introverted than I am.
Yeah, yeah,
We used to get in fights because I would be like, "You're ignoring me. You don't want to talk to me. We're supposed to be sisters. We're supposed to be close." But then I was like, "Okay, she needs her alone time to restore and recharge. And if we
yeah,
can just schedule one time a week
yep,
where she has to talk to me,
yes,
and I have to know what's going on in her life, and she's prepared for that, and she knows that's when it's gonna be, like, we're good.
yes,
We're
yes,
chilling." So knowing like, okay, my friends might have different baseline or my family might have different baseline, and I can accept that and we can find a little compromise
mm-hmm, mm-hmm,
instead of cutting them out of your life
right,
or being mad at them or whatever that might be.
yeah. Another example of that, I have some dear friends who they've been married like 30 or 40 years, and they that's called blue chair time. So like she's an extrovert, he is an introvert, but
Yeah.
they like, he's a pastor, so he's like, constantly speaking to people. She loves like to be in the congregation and talk to people
Yeah.
and whatever. He'll come home from something, and she like can see it on his face at this point, and she'll be like, do you need some blue chair time? And he's
Yeah.
like, I need some blue chair time. And it's his time. He can sit in that chair until he's good and ready,
Yeah.
read, do whatever he wants. You know what I mean?
Yeah.
Like have some internal quiet time. And she
Yeah.
knows, okay, I'm gonna go distract myself with something else, I got other things to do, whatever.
Yeah.
So working out some kind of a system like that is
Yeah.
huge.
I love that. I love
Yeah.
that. We have our name for it is hermit time. Do you need some
Hermit
hermit
time.
time?
I love that. That's so great.
Yeah.
10 out of 10. All right.
Yeah.
Well, I loved that you had a question for both of us. Do you want to ask it?
Sure.
Okay.
Okay. So the question that I heard on a podcast a couple weeks ago was, what is one message you wish every woman had heard earlier about her body? And I just thought it was really powerful, and I really liked the podcaster's answer, and I thought that would be a good question for us
What
from our.
what was the podcast?
It was. I'll send it to you. I can't remember what it's called. It's like an offshoot of. Do you know? What's her name? It's Audrey or Aubrey Van Gordon? Do you know who that is?
No, I
It's
don't.
her big book, or her big thing that was famous is 19 Myths About Fat People or something like that. It's like a
Interesting.
big purple cover. I can't remember
Okay.
what the exact title is.
Now I have a new book to read and a new podcast to check out. I love
Yeah.
it.
Yeah. So she and her partner on the show so she does a podcast, and then she also does a book. And I think the podcast I was listening to was somebody that was on their podcast. So I need to look up what it was
I
called.
love that.
But essentially they just like do a lot of lit searching on a topic, and then they talk about it every week, because a lot of times like there's like the origins, like one I listened to a while ago was like the origins of how BMI came to be.
It's a fascinating tale, isn't it?
Right. Yeah. And so
Swedish
like learning
boys.
that it's kind of BS.
Yes. It is completely BS, actually.
Yeah, completely BS. I was
Yes.
like,
Yep.
oh,
Yes.
okay.
And yet it's required for every Medicare patient. Like, that
Right.
makes sense.
And it's required for the military, and it's required
Yes.
for, like, it's insane.
Yep.
Everything
Yep.
that it's required for, and there's no backing to it. So
Yeah. Yeah. So I think my answer to that question would be that being strong is cool. And like take that however you want, but like in my world that means like having some resistance training, having some weight
Yeah.
training within your tolerance. That's good. And what comes out of that is also fueling your body appropriately for that task is critical. Because I don't think we're ever really taught, like, yeah, we know what like good eating is, but like that looks different for different people and also for different activity levels and things like that. And that's, I mean, I think that's part of why I got a stress fracture is I just wasn't eating enough, right?
Yeah.
So like
Yeah.
knowing that it's okay, like giving yourself permission to do difficult things like resistance training, like running, like rowing, whatever you may want to pursue. And I do mean in a physical sense. That's okay. And then fueling yourself properly for that is not just okay, it is necessary. It is imperative that you do that. And your body will tell you in ways that are not so fun when you aren't
Yeah.
doing that, right?
Yeah.
So anyway, yeah, I think that's
I
mine.
I love that. That's very similar to, so I had two, I couldn't pick between.
Love it.
Very similar to my first one was learn to love your body for everything that she does for you. She's part of you, and you have to appreciate her and work with her rather than punishing her with grueling exercise or starving her. So nourishing your body and yourself in whatever means are restorative for you. And then my second one was, and this is very much my trauma therapist brain. If something feels wrong in your body or you get a bad feeling about something, trust it, lean into it, and explore where it's coming from. Don't ignore it.
Yeah. I love that.
And I
'Cause
think
how
that can
often-
go in a lot of ways too, you know.
100%. And how often do we ignore that signal? And how often are we taught as women to ignore that signal?
Yeah.
When in reality, like that sixth sense, like keeps people safe a lot of times.
Yeah. Yeah.
Yeah. Well, I love
Oh,
that.
yeah.
Thank you so much, Grace, for being on the podcast. I really appreciate
Yeah.
you being here. Any
Yes,
final
thank you
thoughts?
for having me. I don't think so.
Where can people find you?
You can find me on Instagram and TikTok, Therapy W Grace. To be like therapy with grace, like have grace for yourself. That's
Love
kind
it.
of like I thought that was a good play on words. I was
That's
trying to be clever.
fun. I love that.
And then I am practicing in Timonium, Maryland, above Riley's Oyster, if people know where that is. And my website is campsenwellness.com. CAMPSEN wellness.
Love it.
Cool.
Well, thank you so much, Grace. I'm so excited for you on your new venture on your own.
Yeah.
Very exciting. And thank you so much for being on today.
Yes, thank you for having me.
Yeah.
Thanks for joining me on Flourish Well. If today's episode resonated with you, share it with someone who might need the reminder that they're not alone.
Keep taking small steps. Keep choosing yourself. Keep choosing to flourish. Until next time, be well, stay grounded, and keep growing.